What does hypermobile posture look like? In my practice, I deal with joint hypermobility and biomechanical stability. So in other words, stability of the posture and the joints are what I focus on and what I can help my patients with. So when a patient without knowing that they're hypermobile, when they walk into my practice or if I'm outside watching people, what I notice is a lot of times they stand on one leg versus both. Typically when they're walking, if they're walking with their feet out, they're locking their knees because they already know their knees are not their most strongest for their forte. So they walk a little bit rigidly and they clench their butt, which is a telltale sign of pelvic floor dysfunction. On the opposite side, I see a lot of them walking with a tiny bit of bend, and there is excessive internal external rotation. So as they step forward, the leg goes in. Once they put all of their weight on that foot, the knee goes out, and then they do the same thing. So there's a lot of this movement that's happening quite a bit. As far as their posture is concerned, there is a lot of bending at the diaphragm with the pelvis tucked forward in front of their ankles with the tuck under tail, just like that. And when they're standing, there's a lot of hyperextension. The back of the knees go out and being too far forward in that excess movement. When I'm talking to them, there's a lot of hand movements and a lot of neck movements like this, quite a bit of that. And there's a lot of what I call turtleneck. So there's a lot of shoulder shrugging and grinding of the neck into their body, a lot of that. And of course, the neck is over here. And then there's way too much of this movement or extreme movements as they're staying still. A lot of times there is a lot of stretching back. If they're not being careful, they go all the way in the back and just very uncomfortable and in their position. Interestingly enough, when it comes to their feet, they don't all have collapsed arch. So let me explain. The collapsed arch and flat feet happen when there's a standing up. So if this is the foot and there are a lot of bones here with a lot of ligaments that are holding them in place and a lot of tendons that go by, when they're standing up, there is that collapse of the arch happening there. So there is a lot of flat foot, functional flat foot, meaning they really, if I were to look at their feet, it wouldn't be flat. It's just when they stand up, it appears to be flat. And one of the reasons why I think having a hard arch is a good idea. But those are some of the common things that I see. Of course, if they're sitting down, there is that curling of the toes. That's a very hypermobile thing that happens where you're sitting like that, or really sitting like this, which I can't do, but kind of like, I guess I can do like that. It's not to this level, you know, the frog thing. So there are a lot of presentations that we can tell if the individual is hypermobile. I just think that it's kind of cool to be able to tell, and of course even better to watch yourself to make sure you don't go to those extremes of movement, because that's where the injuries happen. Thank you for watching. If you haven't subscribed to the channel, it's a great opportunity to do so now. Make sure you put your comments and your questions down below and I'll answer. Until next time, take care.